Our next presentation is a ASX-listed company called Optiscan Imaging. We've got the CEO, Gus Holt, here. And to give you a bit of an introduction, Optiscan is a global leader in development and application of miniaturised microscopic imaging technologies for medical markets. Two of their clients have included Pentax and also Carl Zeiss. They've got the stock code of ASX OIL. So I don't know how a medical device company got the stock code of OIL, but well done to them. Please welcome Gus to the stage.
Thanks, Steve. Optiscan is now a reasonably mature Australian biotech company, having listed in 1997, which was when my initial involvement came to the fore, when I was in the funds management industry, and we contributed around about $1 million of the first $3 million that the company raised. After that, I simply followed them through as an interested investor. We exited funds management quite soon after we invested in Optiscan, and in 2008 I ramped up my interest quite significantly in Optiscan when, like a lot of other biotechs, there was a significant shortage of cash, there were some operational issues, and consequently what I thought at the time was quite a reasonable private equity opportunity. So now, having gone through a lot of change, 2008, 2009, we had to reduce the scale of the company. I entered the board in 2009 as chairman, and 6 months later as executive chairman, and now hold approximately 10% of the company. That's where my entry into Optiscan evolved. What I'd like to, massive disclaimer, what I'd like to take you through is explain what Optiscan is, how we go through the technology phase, what the technology is used for, the support of very significant clinical trials, the markets that are relevant to Optiscan's technology. Indeed, Optiscan's been in market for 6 years. This is not a startup company by any stretch, and how that then flows into the company and the opportunity. I've taken out the appendix of the competition and major players simply in the attempt to stay within the 10 minutes. But there is competition emerging as our markets mature, although we have a very robust protection via 50 patent families and a lot of internal know-how. The technology, which is pictured there, is it's miniaturised microscopy. The purpose of the float in 97 was to provide additional funding around IP that was developed out of CSIRO and Monash University in Melbourne, in order to advance the concept of bringing the microscope to the human rather than the other way around, and with the aim of imaging cells live within the body, allowing ultimately immediate diagnosis and all the benefits that flow from that. It's a unique combination of hardware technology in the box, which is a picture on the left, laser technology, optical fibre scanning, lens technology, quite a eclectic collection of IP. That particular picture in the right-hand bottom corner is a picture of the Pentax product that was launched in 2006. Our technology is a combination of Pentax technology and our own, which is integrated into their flexible endoscopes. We manufacture in-house. There are no real scale issues for Optiscan around meeting volume. There's a lot of know-how within the manufacturing process, and as it says there, we're an ISO 13485 quality accredited company. As I've mentioned, we have a very robust intellectual property portfolio. We continue to add quite significantly to that, which is the major focus of where Optiscan's at. We're an IP technology development company with the capability to manufacture. We're not a distributor. We work with leading partners, as Steve mentioned. We work with Carl Zeiss and Pentax presently. We've had no issue with any patent infringements over time. Indeed, there's been money flow into Optiscan over time. with others infringing Optiscan's patents. And we have a very long technology pipeline development process. We can presently see product out at least 10 years. The technology that was in the Pentax product is what we now refer to as our first generation. It's a tad out of date now in terms of being a little bit too big to fit into current endoscopes. Second generation technology, which has largely been developed for Zeiss neurosurgery products, is now complete, and we're in the final stages of regulatory process clearance for that Zeiss product. That second generation technology platform applies across many different medical areas, as I'll show you later on. The purpose, as I've mentioned, the purpose of the technology is to view cells live in the body, which allows, and there's a lot of clinical evidence directly relating to our product that supports this, allows a see and treat approach. Allows fewer biopsies to be taken, more accurate biopsy or targeted biopsy. Greater disease is found, it's less invasive. It's an early detection device. And those last two are more in relation to the neurosurgery space, which is currently our most active space with Carl Zeiss. Better margin identification, particularly important in brain tumour resection, so as to not take healthy tissue. And indeed, it allows immediate diagnosis and better intraoperative decision making, and consequently less time on the table as opposed to taking biopsies, running them down the hall, finding out what it is while the patient's still under and nothing happening to them. The efficacy of our technology is well and truly proven. The Pentax flexible endomicroscope with our technology embedded within it is at 7 of the 10 top hospitals in the US. We've pretty much worked with the who's who of the US, as you can see there. There's a German institution there as well. We do a lot of ENT work, and that's via Zeiss as well. Little orange box down the bottom left is the Barrow Neurological Institute. That's where we do our neuro work with Carl Zeiss. That does more neurosurgeries annually than any other hospital in the world and has the largest residency program in the US for neurosurgery. Pretty well validated technology. A lot of trials flowing on from that. There's been multi-centre trials throughout the world, largely in gastroenterology because that's the Pentax space. More intensive now in neurosurgery. As I said, the trials in conjunction with Carl Zeiss are being undertaken at the Barrow Neurological Institute. Optiscan also in the past has done a lot of its own trial work. This is less relevant now because the technology's gained a lot of traction over the past 10 or so years, and we find the need not to really inject any money into trials. They take place by themselves. But it has covered a very, very broad range of potential applications. Gastro, where it is. Cervical, the imaging is extremely good. Endometriosis, early stage, and so on. A recent, very significant trial was presented in May this year in the US, multi-centre trial around comparing current best practice endoscopy and then incorporating that with endomicroscopy. The results were highly compelling. Again, you look at where the trials took place, it's pretty much a who's who. Multiply better diagnostic yield, no disease miss, which is quite phenomenal. And not only changing an incorrect diagnosis to a correct one, but then correctly changing the treatment plan. The markets, gastro in market for 6 years via Pentax. There's been many, many procedures using our technology, 20,000 plus, very clear patient, clinician and system benefits. The gastro market is now set for US insurance reimbursement as of January. And the addressable market, it's hard to pinpoint because none of the players release much information about their sales, but it's well in excess of $1 billion. as an example, it makes Olympus more money than anything else they do. That's a current market. It's one we're looking at re-entering, and a long way along the path to re-entering with our second generation very soon. Arrangement with Pentax is non-exclusive now. The neuro space, we expect to be in there in early 2014 financial year, July probably. That alone should move us to a cash flow positive year from 2014 financial year and beyond. Not so price sensitive in the neuro space. To give you an idea, our systems, the retail price of our systems is anywhere from 100 grand upwards. Can't tell you what the wholesale price is, we're the wholesaler, but our margins are well in excess of 150%. There's a lot of medium-term markets. Carl Zeiss ENT market is more of a near-term market. They have ophthalmology and breast, and a number of others below that have all had investigation done. Company and the opportunity, been through a fair bit of that already. There's been over 90 million go into Optiscan over the past 15 years. That's a mixture of equity, sales, milestones, and as I mentioned at the start, Optiscan is a company that we've rescued from problems during the GFC. Fantastic underlying asset of IP and pipeline and people. Of the 17 people that we have, that's 14 odd full-time equivalent, well over 100 years aggregate at Optiscan. I've been through most of those milestones. It's not a new company. Company on the cusp of re-entering GI, entering the neurosurgery space, and what we're really looking to do now after the past 3 years of resurrecting a very good asset is to start telling people about it. We should be cash self-sustaining from now on. That's in the absence of other opportunities that may need cash, but where we sit today, we've got a reasonable balance sheet, we've got a very good outlook on our cash generation, and are not looking for new money necessarily unless there are greater opportunities beyond our immediate focus. So thanks for your time, and I will be available here at the end of this session. Thank you.